All right. Well, I already see the numbers coming in. Thank you for being here, everyone. Hi. We'll get started in a minute. We'll just give people a little bit more time to join us. Wow, numbers are going up. All right. 1 minute. Awesome. Cool. Well, we have a little bit of housekeeping to get out of the way. So let me maybe just do that and then jump right in. All right. Cool. So again, thank you so much for being here today. As you know, you're in a webinar entitled Innovating in Women's Health, Bridging Gaps and Building Futures. My name, in case you don't know me, is Kathrin Folkendt. I'm the founder and CEO of Femtech Insider, and we're a publication that's all about women's health innovation and sort of covering the many amazing things that are going on in this, nascent but like quickly evolving space. And so what I will say is I actually started Femtech Insider 5 years ago, with the intention to bring more clarity and bring more awareness to that space and just, cover what it's really like to build in this space. And so I could not be more excited about this webinar today, where we have two really pioneering founders, Valentina from Daye and Elizabeth from Adyn, with us, who will talk about, their experiences building two leading gynecological health companies based in the UK, in the US, active on a global level, and what their experiences have been like really innovating for half the world's population while working towards closing the gender health gaps, and also sort of raising money as female founders and dealing with the stresses of running companies, startups on a daily basis. So Elizabeth, Valentina, thank you so much for being here. Thank you for having this conversation, and thank you for sharing your insights with our audience.
Thank you.
Awesome. So what I like, one more thing maybe before we kick things off. So I know we have quite a few people on the call, and we have a little bit of support in terms of helping us moderate the chat. So thank you so much for that, Elisa. Please do feel free to use the chat throughout this webinar. I will try to keep a little bit of an eye on it, but if you have any specific questions that you want us to get to at the end of the webinar, please do use the Q&A functionality here in Zoom. It's just easier for me specifically to get an overview, and experience has shown that I tend to, kind of get a little bit distracted by actually listening to our sort of panelists, so I don't always have my eye on the chat. But yeah, we'll do our best to get your questions or address them after the webinar. This is also being recorded, so we will be able to, share sort of a little bit of a recap with you after the webinar as well. And yeah, with that being said, I also encourage you to talk maybe in the chat. Let's kick it off by introducing yourselves and talk a little bit about why you're here, what your interest is in women's health innovation. Let's also kind of use this opportunity to kind of build a little bit of community and get to know each other. Okay, so but now back to Valentina and Elizabeth. So again, thank you so much for being here today, and maybe I'll just ask you to get started. Maybe let's start with you, Elizabeth. Can you tell us a little bit more about yourself, about Adyn, and how you got into building this company?
Yeah, absolutely. So for anyone who isn't familiar with Adyn is a precision medicine company, and our first product is the first and only test designed to prevent birth control side effects. And so the idea for Adyn really came from a combination of my own personal struggle with birth control side effects and also my academic background in human genetics. So I have a PhD in human genetics. I worked a lot on rare undiagnosed childhood disorders, epilepsy, and autism. But while I was doing that research, I also experienced really severe depression on birth control. I actually had suicidal ideation, and unfortunately, it took a really long time for me to figure out that my birth control was to blame. So when I finally switched methods and started feeling better, I talked to friends and found that some of them had maybe not depression, but I had a friend who had her gallbladder removed. I had two friends who had blood clots. I had a friend who had crippling death anxiety. And then on the complete other end of the spectrum, I had friends who were like, no, I love my birth control, right? My mood is more stable. I can manage my periods. It helps with my skin, et cetera. And I just realized that this was a precision medicine problem. So there are 200 options on the market, at least in the US. And doctors really rely really heavily on trial and error, which leads to 77% of women trying 3 or more methods, with the number one reason for switching being wanting to avoid unwanted side effects. So it just became clear to me, it was one of those things where I felt like I had this calling, and the more I thought about it, the more I thought about our approach of combining genetics with hormone data to help do this precision medicine approach, that I saw there was power in it, not just for birth control prescribing, but well beyond that. And so it just became something that I felt I needed to do. So founded adyn at the very end of 2019, and have been working to bring this vision to life ever since.
What about you, Valentina? Do you want to tell us a little bit about yourself and your work at Daye?
Yeah, and thank you, Elizabeth, for the work that you do and for sharing your story so candidly. It very much resonates with me because I've tried every type of contraceptive option under the sun. Like probably a lot of the people on this call and a lot of women and AFAB folks. Similarly to you, I started Daye because I was personally inspired through my own pain and suffering. So I had my first painful period when I was 9, which at that time was considered young, but now it's closer to the average age that people start menstruating. And age 11, I got placed on oral hormonal contraception, which is still our main line of defense against period pain. And it works really well for some patients, particularly those with endometriosis and adenomyosis, but it's not a foolproof solution for period pain. And it certainly shouldn't be our first point of call when it comes to treating period pain, because there should be non-hormonal and safer medications that you can take, particularly when you're young. Later in life, I developed ovarian disease, which I still have to deal with to this day. I started growing these crazy ovarian cysts that were filled with hair and teeth because my cells were going rogue. And doctors know so little about how to treat cysts. I was literally admitted into hospital one night, prepared for surgery in the morning, so like shaved, given a gown, and then the morning came around and there was a new shift of doctors and they said, oh, no, we would never operate on a cyst like this. So then I was discharged and sent home, which was, the entirety of my gynecological health experience has always been very humiliating, disempowering, and just filled with confusion instead of filled with answers and support. So I always felt that the most important thing that we can do within this particular lifetime that we're born in, this 100 years, is to do better in gynecological health, because over 51% of the population, if you imagine the Maslow hierarchy of needs, we're stuck on level 1 because we have unmanaged period pain, unmanaged vaginal infections, unmanaged menopause, and it affects our societies and economies. It's a lot more than just the personal pain and suffering. So that's what really inspired me to create Daye. I also started the company out of intellectual curiosity. I just one day, reading research papers, had the idea for a pain relieving tampon. I wanted to explore that. Along the way, I just learned so much about the way the tampons are manufactured, about how crazy monopolized the tampon industry is, which then led to Daye bringing manufacturing in-house, which is definitely not something that I had envisioned, and it was not something that I pitched any of our initial investors. So if any of our initial investors are on this call, I apologize for effectively leading you on to invest in a company that ended up being very hardware, very clinically, and very regulatory focused. That was definitely not the original intention. But what we do at Daye right now is we have 2 main products: the pain relieving tampon, which is aimed at the 90% of people who experience period pain. And more recently, we introduced a diagnostic tampon, which enables people to screen for common sexually transmitted infections, high-risk HPV strains, as well as vaginal infections, all from the comfort of their home, removing the need for an invasive speculum exam, at least at the early stages of diagnosing the disease.
Amazing. I mean, congratulations to both of you for, dedicating, as you said, that's what we choose to dedicate our lives to a certain extent. And I know this journey is not always easy, and it's particularly not always easy for anybody building in women's health and for anybody being a female founder in the startup ecosystem. And I'm just curious sort of what have this journey, the many ups and downs. Valentina, you talked a little bit about the pivots along the way, or sort of the realizations you had along the way. Sort of when you look back to, you know, when you started out to what you envisioned your companies to be and where you are today, like what has that been like in terms of navigating that, in terms of fundraising, in terms of also, you know, what you learned or how you grew as a founder? Maybe let's start with you, Elizabeth.
So we could spend the whole rest of the hour on just this question, probably.
Oh, I'm up for it, you know.
Yeah, I mean, I think, you know, building a company from scratch is obviously very hard, and I knew that going into it, at least in theory, right? But I also said to myself, well, you know, I've gone to PhD, I've done other hard things, like maybe this won't be that bad. You know, it's definitely challenging. And I think one of the challenges is just like the lows are low, but the highs are really high. And you can also have those highs and lows happen in the same week or in the same afternoon. And so it's just a matter of really being resilient and learning to trust yourself and get other good people around you who you can, you know, lean on and trust. I think it's also been just really, I think, humbling to realize how much misinformation we're battling in this space. I really think I underestimated that, and I underestimated how much kind of snake oil is out there already populating the market, which gives people some distrust of new products, which is understandable. And I know we'll touch on that earlier or later, I mean, but yeah, I think, I don't know. I mean, maybe Valentina can go, and I'm sure I'll circle back with more thoughts on that.
Yeah, so this is a point that is highlighted many a times, but in my personal experience of building Daye, the biggest difficulty has always been fundraising. You spend so much time fundraising, whether it's speaking with investors or writing grant publications so that you can obtain public funding. When we were raising our Series A and applying for multiple grants at the same time, I was just typing so much, whether it was due diligence questions for investors or grant applications, that I developed repetitive wrist strain injuries on both of my wrists because I was literally typing all the time, 16 hours a day. And it's hard to fundraise for any type of startup, right? Like venture capital invests in a very small percentage of the companies overall. But when you look at the percentage of funding that goes into gynecological health or that goes into female founders, it's tiny, it's single digit percentages. And you are constantly met with a lot of bias and a lot of preconceptions, which I found for me personally, at least in the first, I would say 5 years of building Daye, would really drain my energy. I've now learned a very important life lesson, which is just don't take anything personally and don't try and change every single person that you meet with. You are not going to be able to, like, I will not personally solve the sexism in the venture capital industry or the sexism in the public funding industry. So I have, given up on spending my personal energy for this battle because it used to completely drain me on a physical and psychological level. And the secondary issue, which is very much associated with the lack of funding, is how do you keep your people happy when you can't pay the best salaries possible? You can't offer job security. Daye has been, and this is not something that we speak about in public frequently, but we've been through multiple rounds of layoffs in the company when we've had to, navigate fundraising difficulties and navigate changes in the financial landscape as a whole, but also investors giving term sheets and then pulling them back, or us thinking that we have a line of venture debt available to us and then that being taken away. And what I have struggled with the most in my founder journey, and nothing makes me cry like Glassdoor reviews make me cry, it's the hardest thing, keeping people happy when you can't give them, when you're building your business in conditions of extreme scarcity. So you can't give them job security, you can't give them the best pay, you can't give them the best perks, even though you really want to. That's what I've struggled with the most, other than the fundraising issue. And I do believe they're both very deeply interconnected. But when I was first founding Daye, I thought, the hardest things will be manufacturing and clinical trials and regulatory approvals. And these things are very hard. But they're not as hard as the constant daily fight for, to be taken seriously in our industry and to give your team and your people decent working conditions, which is really hard to do when, you're scrapping for pennies.
Yeah. Yeah. And I think it is a systemic problem, and I almost try to find comfort in the data that backs up why it's so hard to raise as a female founder, compounded by working on something that's a female-specific problem. So, you know, there's clear data showing that investors who are women are twice as likely to fund other women founders and 3 times as likely to invest in female CEOs. And then you add that stat with the fact that between 2015 and 2020, the number of women-led VC firms nearly quadrupled. However, that still means that only less than 6% of VC funds in the US are women-led, and only 5% of partners are women. So it's just the odds are stacked against us. And actually, Valentina has been just, I think, a good founder friend to me and really supportive in saying, like, you know, it's a numbers game. Like, that's just part of how it is, and it will always be hard. And so I think one of the most important things about being a founder is just kind of having that grit and determination in regard to everything. But I think fundraising is one of the most obvious ways that plays out and manifests in needing to have that rigorous, you know, determination and belief in yourself when you're constantly getting other messages.
So, I mean, you both are working on things that are just categorically novel, right? And then in the women's health space. So I'm curious, like, have you seen a difference in terms of raising earlier on in the earlier stages for your company? Like, just maybe, or maybe not, to give people hope, does it get easier to a certain extent as you move through your sort of fundraising journey? Or also how have you found sort of, I mean, you've both been at it for a few years now. How have you found the ecosystem change in terms of just like the overall educational level around, you know, women's health that you're seeing in investors that you're pitching?
So I'd say that it gets both easier and harder. It gets harder because the pool of capital that's available for Series A and Series B and Series C companies gets progressively smaller and smaller and smaller. And then the decision makers on how to deploy this capital get progressively more male and white and old as you progress up the fundraising ladder. In terms of how the industry has evolved, I see a lot of lip service being paid, and I see that as both a positive and a negative, right? Like, at least we're part of the conversation, at least we're taken seriously this way. But I'm frankly quite tired of being invited to, venture capital brunches and breakfasts and dinners to talk about why Femtech is important when none of these venture capital firms have invested or plan to invest in an actual gynecological health company. And then about the gynecological space more broadly, because there's such a scarcity in our space for funding, for success stories, I find that there is a risk of female founders kind of turning against each other because of that traditional scarcity mindset of there has to be one Femtech company per a fund's portfolio, or there has to be one successful Femtech founder. And I think it's really, really important that we bind together and we fight the injustices in our industry side by side. Even if there is like some small level of competition within our tiny companies, first of all, we exist in a huge space, so we can both be solving for the same problems and still build successful businesses. But second of all, like adyn and Daye, we're in the Femtech space together. If we can enable better outcomes for each other's customers and each other's patients, that leads to better outcomes overall. So it's really, really important that we stick together and that we fight this, very natural human urge to respond to scarcity with, oh, only I can be successful and I have to make sure that others are not, or being really paranoid about speaking about what your company does, being in stealth mode forever. That really doesn't.
Yeah, I completely agree. I mean, I think right now in women's health, I have this attitude that more tools and more options is definitely better. And I also hope that then we get to a point where, because the sector is more developed and more mature, that then we shift to hoping that we are focused on better outcomes for individuals being better than just more. And so I hope that we as a community, and when I say that, I mean VCs, government, health systems, payers, the consumers themselves, start investing and supporting, resources into those options that really help the tools that are improving outcomes to increase distribution, improve the those standout products themselves, and ideally move towards being able to get, increasing access via things like insurance coverage and economies of scale, letting us bring down costs.
So one thing, first of all, I think it's so powerful what you said also on, the scarcity mindset, because I feel like specifically as female founders, and I also see that myself, we're almost conditioned into believing there's not enough space for all of us. And that sort of, puts this thought in our mind that, it's like one against the other. And I think that's just like, because, the system that we're up against sort of in the venture world, I'm not venture backed, but I still feel it. It's like kind of, did you see what X is doing? Did you see what? So it's almost, kind of egging you on in terms of, feeding into that. And like, then, obviously, sometimes again, you have like ups and downs throughout the day, and sometimes very high highs, very low lows. And, if it gets you like at the wrong time, you're like, oh my God, yeah, maybe they're right. And so I think I 100% agree. It's like kind of, really, we constantly need to remember a rising tide lifts all boats. And, in the end, we're all here to work towards a common mission of better health for all. And on that point, I think one big part of better health for all that has actually gotten a lot of attention as of recently is sort of the conversation around the women's health research and the data gap. And so I think the conversation is such an interesting one, because on the one hand, it's a struggle for a lot of companies in our spaces, because they don't have a lot of data to actually, in the very beginning, to base their solutions on. But on the other hand, as we're seeing in your cases, it's also an opportunity to actually contribute to research and make a difference in these spaces. And so I'm kind of, curious about how you're looking at sort of the gender research gap, how your companies are contributing to that. And also maybe if you want to talk about that a little bit, we're hearing a lot specifically in the US around, the Women's Health Research Initiative that was recently announced. So what's your take on kind of the women's health research gap? Maybe Valentina, let's start with you.
Yeah, so I'm happy to speak in just exact detail about the way that they set up our initial clinical trials, because we started with the pain relieving tampon, and there was absolutely no data on how cannabinoids can be taken vaginally. In general, vaginally administered medications, it's a very poorly researched space. Tampons are not considered medical devices in most geographies, so there are no clinical trials on tampons. And I had, in the early days of Daye, so I funded the company by myself for the first 18 months. I didn't have access to external funding that I could tap into in order for us to run a clinical trial. So I was just reaching out to a number of different CROs, sending emails all the time saying like, hey, this is what I want to do. Can you help me design my clinical trial? Can you help me think through, different gaps in our study design? And I know we're often advised not to send out cold emails and to wait for an introduction. And I feel like that's such privileged advice, because what if you don't have a large network that you can tap into for warm introductions? Like, you're just going to sit on your hands. And in my experience, if you are respectful of the person that you're seeking advice's time, and if you write your email in a very clear way where you have some specific questions for the other person, people are always happy to help. And, as human beings, we have an ego. So a little bit, there's that dynamic where your ego gets tickled when someone asks advice and needs your help. So the way that I ran our first clinical trials, after emailing, every CRO basically on the face of the earth, I found an obstetrician who found the concept of pain relieving tampons interesting. He has daughters who have painful menstruation. He's had many patients who have painful menstruation. So he had a CRO facility, and he allowed me to pay for our first clinical trial in monthly breakdowns rather than as a one lump sum, which is a very, very unusual way to fund a clinical trial. And it also places the CRO at huge amounts of financial risk, because they're upfronting the costs for patient recruitment, for analyzing the patient, for doing the doctor visits, etc., for actually providing the tampons. But there are people out there that will be willing to help if you structure your question in the right way. And once we had this initial clinical data, we could open doors to academia, and we could open doors to research trusts and hospitals, because when you reach out to academic researchers, they always ask, oh, what's your data behind the solution? And if you don't have any data, it's really hard to take the conversation forward. So with this initial imperfect clinical trial, we at least had some data. It was a small clinical trial, 120 women. So not statistically significant, but it enabled me to then reach out to Liverpool Women's Hospital, reach out to hospitals in the US, and be taken seriously. And then hospitals have research budgets themselves. So if you find a PhD or a research group who are interested in the question that you're interested in, they might be able to finance your clinical validation out of their own PhD, etc. budgets. So that's what Daye was able to do. We worked with the Wellbeing of Women, which is a trust that provides, it's a charity that provides donations for clinical trials in the UK. And we worked with Liverpool Women's Hospital, which is an NHS trust. And that's how we were able to build on top of our initial clinical data. But the gender research gap is very real. It's very deep. We should all be working to find solutions and answers on what causes gynecological disease and how best to treat it.
I think sure. Yeah, I can add a little bit to that. The research gap is a big part of what motivated me to start adyn. So in my academic research, I encountered a couple of health inequities that I knew I wanted to solve for. The first was anytime I went to sequence individuals of non-European descent, we just had way less statistical power to make discoveries. And the second was because of the gender research gap, women in the US weren't required to be included in clinical trials until 1993. The amount of funding that goes towards conditions that disproportionately or solely or differentially impact people assigned female at birth is just minuscule. And so the good and the bad news about that is there's a lot of low-hanging fruit. But I think to echo what Valentina said, we were also sort of in this chicken or egg position when I started. So, we now have a very large database, probably the largest in the world with regards to birth control and specific side effect profiles. And we were then able to launch on the back of existing years of research, though I would say inadequate, to help us already improve, start where we can, right? Start improving the standard of care by providing this clinical decision-making tool that we've created. And now we're at a point where we have a lot of really incredible clinical proof points that are then going to let us expand more quickly. So we're actually being approached by prescribers who understand this problem intimately because they're faced with every day dealing with, patients coming back with unwanted side effects. And so I think, Valentina, your approach is amazing. You're so lucky to have those people who believed in you and supported you. And I think that goes to show just how female founders are incredible and scrappy and are going to do what we need to do to help solve these problems that have been otherwise ignored. And I do think, Kathrin, to your point, the Women's Health Research Initiative in the US is a huge step forward. They've earmarked, I think, $12 billion. The first deployment coming with $100 million for grants that are available now. They're due very quickly. So it's definitely appropriately named a sprint. But that's exciting. That's either up to $3 or up to $10 million, depending on the development stage of your product. So it's very exciting. It's a very exciting time, I think, to be building in women's health. But it's long overdue, and there is a lot of work to be done.
So I think, Elizabeth, specifically in your case, also on the kind of contraception space, birth control space, personalization, and sort of, how birth control impacts different individuals in different ways. I think personalization has been a big topic for you. And, obviously now we've talked a little bit about the data bit. And so the idea behind data is really to, kind of custom create healthcare experiences for individuals. And I'm kind of curious, how do you sort of does all the data work and the clinical research you're doing kind of then feeds into like more personalized for healthcare experiences for your just like generally the people you intend to serve.
Yeah, absolutely. So right now, as I mentioned, there are nearly 200 highly effective methods in the US. And birth control, the important thing to remember about it is, in addition to providing freedom from unwanted pregnancy, it's also one of the main drugs used to help manage female reproductive health conditions. Probably a lot of people on this call know that. It's good for PMS, potentially acne, PCOS, et cetera. And so what we can do is help really with informed choice. So what we do is we take genetic information together with your hormone levels from day 3 of your cycle, as well as medical history. And then we use that to give you as much information as possible, both you and your provider. So to give you a sense of how that's working without adyn, I think there was a Kaiser study that showed that only 30% of women expressed that they felt they had enough information to make a contraceptive choice. After patients have gone through adyn, that number is 97%. So it's really a lot about informed choice. And for anyone who read this Washington Post article on birth control side effects that came out, I think last week, it sort of got a lot of pushback because I think people felt like it was minimizing individual women's experiences and talked a lot about the lack of informed choice. And so I think what adyn is doing is really giving individuals that empowered and informed choice. And on the flip side of that, clinicians are also better empowered to do a good job, right? They have massive pressures on them. They often have at most 13 minutes for a contraceptive counseling visit, which is hardly enough time for them to understand all of the contraindications associated with someone's prescription and pick between those 200 options. Plus, they don't have things like genetic risk for blood clot being assessed and at their fingertips. So I think we're doing a lot to help change that status quo and move it into a more personalized and evidence-based clinical decision-making tool.
What about you, Valentina? I think you also had quite a bit of a journey from sort of, starting out, with the CV tampons, and now, with everything you're doing in the digital health space, virtual care space, with the period care clinic, and sort of how are you thinking about the topic of personalization and just, more custom healthcare experiences as well?
Yeah, so when I first started Daye, I always had the idea for a pain relieving tampon and a diagnostic tampon. And the reason why I had these ideas is because they're not novel. So we've known since the 1960s that tampons can be used to provide localized menstrual pain relief. In fact, Procter & Gamble was looking at introducing a pain relieving tampon, but they abandoned the idea because they thought the market would be too small, which is ironic given that 90% of people experience period pain. And then we've known since the 1980s that tampons increased the rates of sensitivity and specificity for STI screening. And it was actually the former Director General of the FDA that completed one of the first clinical trials that looked into tampons for STI screening. So we always had these two ideas. And what we do at Daye is we cover a lot of different spaces in gynecological health. So we focus on menstrual health, hormonal health, and vaginal health. And we have built the telemedical layer, which facilitates nurse consultations, GP consultations, OBGYN consultations, as well as prescription treatments in order to provide a holistic patient experience. So where I find issues with the way that we do gynecological health today is that we try and segment the different components of gynecological health. So we try and treat hormonal health separately from vaginal health, separately from menstrual health, but they're all interconnected. So if you don't have visibility over the way that they interact with each other and the potential negative consequences of treating one and having an impact on the other, I don't think you can deliver excellent patient care. So we wanted to make sure that we provide really holistic solutions for gynecological health, and that we also give our patients as many options as possible on what to do next. Because, for example, with the diagnostic tampon, it can be confusing. So what if you have an STI? What do you do with that information? And currently in the US, 40% of patients drop out from the treatment cycle. So they see that they have a positive STI result, but then they don't start or complete their treatment, which means that they still have an STI positive status, which leaves them more prone to infertility, chronic pelvic pain, etc. So what I want to do a day with the telemedical layer is to ensure that you don't just get diagnostic results or a product, you have your follow-on care available to you as well. So we operate as a prescribing pharmacy, which means that we can send prescription treatments to your door. And we also have an excellent network of physicians and clinicians that we work with who are available for virtual and in-person consultations for our patients whenever they have follow-up questions or they just want to dig deeper into one or another component of their gynecological health. And I think that's what enables us to deliver personalized care. And one interesting side effect of the work that we're doing, so Daye is predominantly based in the UK. We recently received an FDA approval, so on the back of this, we're expanding to the US. But in the UK healthcare context, after COVID, there was a mass exodus of staff from the National Healthcare Service, the NHS. So when we opened up a new role for a pelvic pain nurse, we had over 300 people apply because there's such a huge demand from people who used to work for the National Healthcare Service to still be able to practice their profession, but to do so in a more humane way. And I have a really excellent book recommendation if you haven't read it already. It's not a new book. It's by Adam Kay, and it's called This Is Going to Hurt. I recently reread it. It's an excellent overview of how the NHS effectively operates on human suffering and personal sacrifice. So what we've been able to do now is give these sexual pelvic pain gynecological health nurses a chance to still see patients and practice their profession, but do so on their own terms. So not be penalized if a consultation runs over, not be penalized if they choose to spend that extra time with the patient. And we have a 100 NPS score, Net Promoter Score, on our consultations because people are just not used to having someone be as present and available as they can be in a private telemedical context.
So when I listen to the two of you speak, there are so many similarities in terms of your mission and also, I guess what you're trying to accomplish for the people that you're looking to serve. So of course, I have to ask, are there any plans to kind of, join forces on certain projects or, sort of, collaborate? I mean, we've talked about collaboration in the space a little bit.
I certainly hope so. I think we have already done a bit to think about education together and combating some of this misinformation. And I don't know, Valentina, do you want to take this opportunity to plug your period pain clinic?
Yeah, so the period pain clinic is a way in which we're expanding the care that we provide through the pain relieving tampon. What we learned from our community is that people have a lot of questions on why they have period pain. So giving them a solution for their menstrual cramps is insufficient. So we took all of the ACOG, RCOG, NICE guidelines on how to diagnose what causes period pain, such as endometriosis, adenomyosis, fibroids, polycystic ovarian syndrome. We digitalize them, which makes them a lot more democratically available. And so on the period pain clinic, you can go obtain a diagnosis on what's causing your period pain and then build a personalized pain management plan, which utilizes both pharmaceutical and holistic treatments to best manage your period pain and to maximize pain relief while minimizing side effects. And one kind of side effect that we discovered through the period pain clinic is that the majority of women and AFAB folks take painkillers in an unsafe way. So painkillers, over-the-counter painkillers, they're only effective in different studies say different things, so between 20 and 35% of the general population, because over-the-counter painkillers were not designed for menstrual pain. They don't target the root cause of menstrual pain. They weren't tested on female patients, so they don't work as well in women as they do in men. So what female patients do is they take more painkillers than they're supposed to try and compensate for the lack of efficacy. And if you overtake painkillers, there are a whole host of side effects, such as swelling of the face, swelling of the fingers, gastroenterological problems, etc. So what we're able to do with the period pain clinic is also educate people on safe painkiller use. So similarly to what you're doing, Elizabeth, with your company, instead of demonizing and vilifying contraception and just completely slashing access to hormonal contraception, enabling people to understand what's best for them, what contraceptive regime is best for them. We do that for painkillers.
So you actually mentioned a key point here, enabling people to actually understand what's right for them, what's best for them, and what's actually safe for them. And I think, at the moment we're seeing, and you also, I think, also alluded to it a little bit earlier, that there's a lot of, besides the many evidence-based companies that are out there, there's just a lot of people that are trying to profit of women's pain, and just, the way we're very often not served in the way we should be in the healthcare system. So from a kind of operator perspective in that space, what recommendations do you have, like for like also consumers that are kind of looking for safe products that are right for them in these spaces? What kind of indicators should they consider? What should they be looking for? Also, maybe what are you trying on your end in order to sort of give people the confidence to actually sort of buy your solutions? Because obviously the trust issue is a big one in healthcare in general, and even more so also sometimes in the direct to consumer spaces that many companies operate in. Maybe Elizabeth, I'll start with you.
Sure. I mean, I think building trust is hugely important. And I think a big part of the way you do that is by being transparent about what you can and can't do. And as a consumer, I also think it's a good idea to not be afraid to ask questions, to look for references, to look at advisory boards, to really see where this is coming from. And I think one other interesting way to think about it is almost like work backwards. Like if I were to take or use this product, at the end of it, what would I do next? Would there be an action that made sense? I think I hear from a lot of MDs that they're so sick of people taking these like tests based on really preying on people's kind of health anxiety, right? And then they bring a result to a doctor and the doctor's like, this means nothing. I can do nothing with this. And so I think consumers are smart about this. We have doctors coming to us to ask questions because they had a patient who asked them about adyn, and we'll hop on a call with that provider and talk through it. So I think it's hard. I think it's overwhelming. I think I saw somewhere a company actually that I just remembered that was trying to like help give almost ratings to like women's health company products and their sort of scientific accuracy and medical actionability, though now I can't remember what's that's called.
I think it's Front Row Health. It's like sort of why are providers recommending it? Front Row Health?
Yes, I think that's it. Yeah.
How about you, Valentina?
Yeah, I mean,
content in terms of trust.
To the point that Elizabeth made, so if you have a diagnostic product or, if you have a gynecological health product, it needs to be focused on, clinically significant milestones. And you need to, instead of providing the patient with confusing or overwhelming results, you should only give them information that's then tangible and actionable. So, for example, with the diagnostic tampon that we have, we also offer vaginal microbiome screening, but we only screen for the pathogens that we know are clinically significant, and we know there's a follow-on treatment for them, because otherwise the test just becomes unnecessarily expensive and there's nothing that you can do. So there's frustration, as Elizabeth said, with the provider, with the physician, and there's a lot of frustration with the patient. The other point that I wanted to make is I think it's really important to not underestimate the intelligence of the patient, particularly when you have a female patient who's interested in their gynecological health. They will be perfectly able to understand clinical evidence and scientific articles. So at Daye, we make a big point of just adding references to every single thing that we say on our website, quoting specific research, whether it's our own research or third-party independent research. And whenever like traditional direct-to-consumer marketers or venture capitalists look at our website, they say, oh, this is terrible for conversion. Why do you have, so many research papers on your website? Well, because we need to give people the information that they need in order to make an informed decision about their care. And what I see, what really turns me off from some femtech companies is when they underestimate the intelligence of the consumer and they use this like cutesy language of like calling their customers babe or honey. I'm like, oh no, absolute no. And then if you're a patient that, wants to get the best possible gynecological care, don't underestimate your nurse. So nurses do not get as much credit as they should. They, in a lot of circumstances are more experienced than doctors. They will have, conducted the procedures that you need 1,000,001 times. They will be really well versed, really well read, really well educated, really romance your gynae health nurse, because she will know so much about, the best personalized way to treat you. And she will often approach your condition with a lot more empathy and understanding. So yeah, if you want personalized care, romance your nurse. Not in an inappropriate, in an appropriate.
Yeah, this is kind of the thing that people will kind of cut out of this webinar. Let me ask you specifically on this comment that you made on like kind of, well, there's all these papers on our website, and sort of obviously marketing is always the topic in our spaces. So what have you, and I think about that a lot. So I happen to have polycystic ovary syndrome, right? So this is what got me into the space. And for example, we know women with PCOS, around 50% of us are not diagnosed. So, I obviously still have PCOS, I just don't have a diagnosis. So it's like, how can I even look for proper solutions for whatever I'm struggling with if I don't even know what's going on with my own body? So I'm just kind of curious what strategies you have found that are helpful in terms of educating, women, people in general around these topics, and like how do you reach them with like things, like how do you reach a woman with PCOS that, potentially doesn't even know she has PCOS? And like, how do you, just on the communication side, we can also talk a little bit more about stigma in a little bit, and sort of, the issues that we have around advertising in our spaces. But yeah, I'm just interested in what you're finding effective in terms of actually reaching the people you intend to serve or help.
Yeah, we have invested a lot of time in our creating a blog called Mind the Gap with a lot of scientifically fact-checked information. And the blog has been really successful in terms of drawing people to the site and hopefully educating them on things like that. I think similarly to that, we see a lot of people finding us through Google search because the sort of intent is already really high. They sort of know what they're looking for in terms of symptoms. And I also think the unfortunate truth is still that there's a lot of, I think what would be called whisper networks, like Reddit. If you go on Reddit with people literally talking about like, these are my symptoms, what do you think? Now that is not medical advice, right? So that is not ideal, but I think it plays an important role in for women in particular who have such a history of medical gaslighting to feel validated in those symptoms and to at least get some ideas. Like imagine you're young, you've never even heard of PCOS and someone suggests it, then maybe you have a better thing to Google and a better thing to ask your doctor and a better way to advocate for yourself that next time you speak to a medical provider. I'm not sure what Valentina.
And let me maybe elaborate on that also. Valentina, I'll also let you answer, but like, what are some of these really harmful myths that you have heard? Actually, Valentina, I heard you talk about one about like, oh, you have endometriosis, you have pain, maybe just get pregnant, it will go away. So what are some other of the things that you're sort of hearing in your spaces?
Yes,
some of the myths. Oh yeah, go ahead.
I love to bust this myth. So 2 years ago, I went to this research conference in Oxford University, which was dedicated to gynecological health. And there was a big session on endometriosis with some of the world's leading researchers into endometriosis. And I was so excited for this conference, right? Like couldn't wait for it. I had like a whole list of questions that I wanted to ask. And it was such a huge letdown because the conference opened up with this, one huge name in endometriosis, male, tenured professor, multi-published author in endometriosis. And his whole panel was about how it's unnecessary to diagnose women with endometriosis, particularly if they're younger, because what they will do is assume that endometriosis will make them infertile, because you will tell them you have endometriosis, they will Google endometriosis, and then they will discover the link between endometriosis and infertility. So you shouldn't, if you have a patient who's young, you shouldn't tell them that they have endometriosis, because they're just going to go and have lots of unprotected sex and become pregnant, and then you're going to have to deal with their unwanted pregnancy. And what was even more shocking than this obvious medical misogyny was that everyone else in the room was just nodding along, like, yep, shouldn't tell women that they have endometriosis, because they will go and like fall pregnant, and then we'll have to deal with their abortions. And another really common endometriosis myth is, oh, just have a baby, it will all go away, as if so we have contraception as a way to treat period pain, birth as a way to treat period pain, but no actual, can we instead invest money and time into finding an actual solution that's been designed for period pain, rather than encouraging people to just have a baby and deal with their period pain. And by the way, for 52% of patients, having a baby can make your period pain worse. So it is not a cure-all for endometriosis.
That's
how are you? Yeah, I mean, the moment of silence for this. But obviously, you're putting out content to also, debunk a lot of these myths that are unfortunately out there and that are still sort of, kind of spread in various different ways. How are I, again, going back to my question about how do you actually then reach people? Because unfortunately, and we also talk about that a lot, sort of in the women's health innovation, the Femtech space, the topic of advertising censorships on social media. I mean, I talk about that on Femtech Insider. We're considered not safe for brands, although I run a business publication that, can't get into advertising networks simply because we, mention words like vagina and period blood and sexual wellness. I'm basically considered a porn site, right? Which is just, crazy to me. And I know you're experiencing the same sort of from an advertising perspective. And how do you think kind of, we can break the stigma? Are there any, kind of ways that you found to either directly address these algorithmic issues? Also, what are sort of some workarounds that you're using in order to kind of still, get the word out? Maybe Valentina, do you want to, or Elizabeth? Yeah, go on.
You're right. I can take a stab at it. Yeah. I think we haven't invested a ton in growth marketing yet. But what we found already is Google ads haven't been as much of an issue. We operate in the US. We only operate in the states we can operate in, which is everywhere except for New York, New Jersey, and Rhode Island. But on Meta or Facebook and Instagram, we've been hit with blocked ads and violations, and we have been told that our ads are in direct violation of policies, which is just absolutely not the case. So we've even been misclassified, as we had an ad about birth control that was classified as marketing weight loss. It had absolutely nothing to do with that. I mean, for the record, we do talk about weight gain and birth control risk, but we weren't speaking about that at all. And so one hack I have is we've even just resubmitted the same exact ad, and then it's gone through, partly because I think it's completely random who they send it to do the review, and it's very person specific. So that's not an en masse that's going to solve all your problems. I think it takes a lot of trial and error to figure out what visuals and language are triggering them. And there's also important work being done by the Center for Intimacy Justice, if anyone has heard of that, in helping try to at least bring awareness about this issue and point out just the crazy biases that exist in the online advertising world against women's health products that are very clearly not there for ED meds.
How about you, Valentina?
I think that's the most frustrating thing, is that you can talk about erectile dysfunction all day long on all of the large advertising platforms, and you can show these cactuses or cacti in different stages of hydration. So before the ED pill, the cacti is down and looking very dry, and then after the Viagra pill, it's very firm and pointing to the sky. So that's totally fine, but you can't talk about menstruation, menopause, breastfeeding, anything to do with gynecological health. And what we most recently discovered today, because we had the audacity to run an out-of-home campaign in London, we had a photo of our tampon in the center of the ad, the tampon in the applicator, because we are promoting tampon, and multiple ads across London, supposedly one of the most progressive capitals in the world, were censored. So people took it upon themselves to use tiny little white stickers and to apply them all across the ads, hiding words like fertility, STIs, hiding the tampon. We also had a anatomical model of the ovaries, the vagina, and the uterus, and they wanted to hide that as well. Some incredible people from our community went and cleaned those ads up, but then they were sprayed over with spray. Yeah, so the bans against gynecological health advertising are very real and very pervasive. So we haven't been able to trade on Amazon for the past like 4 months now. And part of it is because we have a product which is a vaginal microbiome screen. A vaginal microbiome screen contains the word vagina in it, and Amazon does not allow the word vagina or vaginal on its platform. What we try to do is, you know, similar to what you do, Elizabeth, we focus our social media presence on educational content on all things gynecological health, whether it's our blog Vitals or our Instagram account, which is a nightmare for, you know, traditional direct-to-consumer marketers or investors. Every time I meet a, you know, traditional social media person or venture capitalist, they're always like, oh, why is your content so education focused? Like, why can't you post more memes? And I think there's definitely space for humor in gynecological health, but that's not what we really need. We don't need humor that much. Humor, and mostly we need education. And then my last thought on just how to reach consumers or how to reach patients is you need to have a really strong brand and you need to have a strong identity that stands for something different. And what I see a lot of founders do is they just fall into the trap of working with an agency. And when you work with an agency, you just avoid the hard soul-searching work which you need to do in order to create a brand identity that's genuinely different and stands for something. And you're not just using colors because they were, you know, the previous year's Pantone of the year, but they actually mean something for you and you're trying to communicate something to your audience. And that's always something that we've tried to do at Daye, is just create a brand that makes gynecological health seem accessible and interesting and that is inviting. And I think that's really important, and you can't do it with an agency.
I mean, we're almost towards the end. So again, I encourage everybody to either in the Q&A functionality, or I'm also keeping an eye on the chat and noting down some questions, but maybe to read something for you that I just saw in chat. I always tell my usually younger patients who are shy about talking about menstruation that if men got periods, there would be tampon distributors on every street corner. And so, you know, maybe we can also close off with maybe having a conversation around that, about like, how do we bring more people into the conversation? How do we kind of, you know, find allies? And what have you found in terms of, you know, building community in various places around your causes and your companies? Maybe Elizabeth.
Sure. I think there was an article, Kathrin, that you covered recently that was talking about founder mental health and how few founders leaned on their investors for support or a shoulder to cry on.
Yeah.
I think that is absolutely true for many reasons we could get into, but I think there is so much support in finding other founders who are similar stage or a little bit above you, who just can understand the struggles that you're going through in a way that no one else can. And that's just been incredibly valuable to me. And I'm very grateful for Valentina and the other founders that I have found that just feel genuine and real and like someone you can trust and talk to and help each other, because it's very hard. And that's been a game changer for me to lean into those relationships.
Yeah, no, no one will understand you like another female founder, because no one goes through the same experiences. And another female founder that's also in Femtech, like it's such a unique life choice and a unique set of life circumstances and hurdles that you have to overcome. And that's why it's so important that we lean on each other and don't see each other as competition and don't see each other as like someone that you have to beat in order to get ahead. But on the point that you made about investors, so one really important lesson that I learned, because I'm a single founder and I started Daye when I was really young. I was 22 when I founded the company, and I had absolutely no like meaningful life experience or venture capital experience or startup experience. So I assumed that my investors would be like my co-founders, or that my board would take a very active role in supporting me or supporting the company. And I think it's really important to very clearly set boundaries and understand who your investors are and what they should do and what you shouldn't ask them to do. So your investors are not your friends, even if they sometimes may try to be friendly with you or invite you to their home or invite you, to spend the weekend with them. They're not your friends. They're not your employee. They are your business partner, and you need to have a very professional relationship with them. So I would never call my investors if I'm, like at the time of crisis or still thinking something through. I don't think it's healthy to assume that you can lean on your investors or like cry on their shoulder. It's just a very different relationship that you need to maintain with them. And when I'm saying this, I don't mean that you need to like hide problems from your investors, but when you do have a problem, you need to have, a whole bunch of solutions. Or you need to say, I don't have a solution for this, but this is my clearly articulated problem. You can't, especially as a female founder, you cannot present yourself to your investors in a state of emotional distress. But you can to your female founder friends. You can call them, you can cry, you can lean on their shoulder.
So yeah, it's really, it's about the sisterhood, and I will 100% agree with that. And I know we're out of time, so we're about to like kind of wrap up. But like I was on a panel recently, and it was really like I walked out of this, and it was really like complete real talk where everybody was like, oh my God, I feel like multiple times every day. And I feel like, sometimes we're almost pushed into these roles where, we need to put on a brave face and sort of be these success stories, or I feel that way, these success stories that the world needs us to be in order to also, bring more women into spaces, into entrepreneurship and so on. And so I think it's quite comforting also to, kind of have these conversations where it's like, well, sometimes things maybe aren't going to plan and you have like these lows as well. And so, yeah, I've definitely also experienced sort of being able to lean on the people in my life and also in my professional life on that. And yeah, I obviously also appreciate what the two of you in terms of what you're doing, what you're building. And yeah, again, I think also normalizing conversations like this where we're just like kind of, talking about what's going on in our lives, in our companies, and just like also the struggles that we're facing. And I think in terms of summarizing one of the key takeaways, it's like really it's a life choice, and it's not always an easy one. And so yeah, thank you for all the amazing work that you do. And I think like maybe we can take one more question because it's so relevant to also kind of supporting others. And I think there have been a few questions around like, well, I have a research background, like how do I, and I'm finding like kind of, transitioning into the entrepreneurial space incredibly challenging. I have a medical background. I'm finding sort of, navigating the fundraising, the managing my board, the, learning how to actually run a company incredibly challenging. And Valentina, you already talked about it a little bit in terms of, what your expectation versus reality. What have you found the most helpful in terms of, educating yourself, learning how to company? Has it been like sort of mentorship? Has it been sort of these relationships that you have with other founders? Has it been like some sort of formal education? What has been the most helpful for the two of you in terms of preparing you for this journey you're on to a certain extent?
So I think so therapy has been the one thing for me that has most supported my mental health and my, evolution as a manager and a leader. And I think if you are a founder, you should definitely be in therapy, because you can't allow your subconsciousness or your lack of self-awareness to impact your team or to impact how successful your company is going to be. So therapy is one. And then having a professional coach, particularly if you're a single founder, is super important. You need to have someone that you can bounce ideas off with, and that will in many situations be your team, but not in every situation. So investing in a professional coach, even if you don't meet them once a week, like say you haven't, because professional coaches can be quite expensive. If you meet with them once a month, I think it's really important to do that, to have this, external source of intellectual partnership and thought partnership. And then just really prioritizing your physical self. I definitely didn't do that for the first 5 years of building Daye. I didn't sleep, I didn't eat well, I didn't exercise. I was working every single weekend. I used to treat the weekends as if they were just a regular working day, but with less emails and phone calls. And I didn't burn out, but I did develop type 2 diabetes because of really high cortisol levels. So if you're constantly in a fight or flight mode and you're never giving your body rest, your body starts overproducing glucose because it thinks you need the energy, and then that affects your insulin sensitivity. So I was 28 when I got diagnosed with type 2 diabetes. And I'm not sharing this to scare anyone, but it's really, really important to prioritize your physical health. So exercising, sleep, nutrition, like just get these 3 basics right. And you don't need to follow like a crazy exercise routine or protocol, just getting your body moving. You don't need to follow like a magical diet, you know, keto or veganism or whatever. Just eat whole nutritious foods, sleep, move your body. You need to do that to be the best version of yourself. And you need to do that to just survive the really intense levels of stress and pressure that you're put under. I like to describe entrepreneurship as it's a marathon, which you have to sprint. So people say, oh, it's not a sprint, it's a marathon. Yeah, it's a marathon, but you still have to sprint. Especially if you're a venture-backed founder and you're always on a runway, you're always running out of money. So you have to invest in your physical health.
That's beautiful. I agree with all of that. The only thing I'll add is encourage your teammates to do the same. Your early founding team works really hard. Set that example for them too, of taking care of yourself.
Yeah,
and I also couldn't agree more. And it's a great, the most helpful thing I've heard in that context was when somebody told me, well, Kathrin, recovery is actually the other side of high performance. And so I think, it's kind of, we need to manage that part of ourselves in our lives in the same way as, we kind of go towards other goals in the context of our business or our personal lives. Sorry, Valentina, I cut you off there.
I was just going to build on Elizabeth's point. So you need to realize how big of a magnifying force you are within your company. People will be reading like micro facial expressions in your face. If you have like a slight change in your energy levels, or if you slightly raise your voice at someone, that will be magnified times 10 because you're the center of your company as a founder and you set the example. So if people see you answering emails super late, working on the weekends, they will assume that this is what you expect of them, even if you don't. So I never genuinely expect people to work on the weekend, but I see that when I send emails on the weekend, people respond. So what I started doing is just scheduling the emails because, sometimes I still have to work on the weekend. This is just the reality of, your workload as a founder, but instead of sending them on Saturday or Sunday, they will arrive on Monday.
Thank you. Amazing. All right, we're already 6 minutes over time, so I think we will save the chat. We will save all the questions, and we'll review everything and do our best to get back to people who asked questions that we may have missed or not gotten to. This has been recorded, so we'll also kind of edit it, look through it, share it with everybody. So please do feel free to rewatch it, share with your friends, your colleagues, your allies, whoever you want to share it with, and my very, very big thank you to both Elizabeth, Valentina, to their teams for all the amazing work that you're doing to really move this field forward, and also especially for being so open and willing to kind of share your experiences and your stories so openly in a forum like this. I know this is not easy, and know you are appreciated, and I'm incredibly inspired by all the work that you do, and also the way you do that work. And I think we also need to acknowledge that. So thank you so much for everybody who joined us today. If you want to learn more about Adyn, feel free to check out the website at adyn.com, but we'll also include that in the follow-up email. And also, if you want to learn more about Daye, it's yourdaye.com. So thank you so much for being with us today, in the evening, in the morning, wherever you are in the world. Again, big thank you to Valentina and Elizabeth, and I hope to see you soon at another one of our webinars. Thank you, everyone.
Thank you so much.
Thank you so much. Talk to you both soon.
Bye.
Bye.